Hey folks, Nick the nurse here. Today we're going to be talking about some of the nursing interventions that you might see come up on nursing school exams or on the NCLEX that deal with diabetes mellitus. Now with diabetes mellitus, interventions can include monitoring the blood glucose and hemoglobin A1C levels. With type 1 diabetes, you generally have insulin that's prescribed. With type 2, you're going to have things like oral hypoglycemics, metformin, glucophage, stuff like that. You're not going to see oral hypoglycemics prescribed in type 1 diabetes because you have no insulin production. You're going to have insulin in type 1 diabetes. You won't always see insulin prescribed by a physician or provider in type 2 diabetes. A lot of times it can be diet controlled, it can be controlled with oral hypoglycemics, and if those things don't work, or an exercise, by the way, at that point they'll prescribe insulin. Now, performing regularly scheduled diabetic foot exams is very important to the diabetic neuropathy, and also diabetic eye exams for retinopathy, very important. We also want to make sure that we know that we provide insulin to the patient as ordered. Now, specifically for your nursing school exams, and possibly for the NCLEX, you're going to need to know the peak, the onset, and the duration of all insulins, NPH, regular insulin, rapid-acting insulin, all of these different things you're going to have to know. I've frequently seen that tested on nursing school exams. Myself, as a nursing school instructor in RN and LVN or LPN programs, as a certified nurse educator, I have tested that. It's one of the most frequent things that we like to test. You have to make sure that you know it. Make sure that you provide your patient with a bedtime snack to prevent Simogi's phenomenon, which is low blood sugar in the early AM. We also want to make sure that we assess kidney function. We encourage moderate exercise per physician's instructions or approval, of course. Want to monitor for signs and symptoms of hypoglycemia. These include diaphoresis or sweating, cool clammy skin, diplopia, blurred vision, headache, hunger, nervousness, shaking, insomnia, and mental cloudiness or confusion. You have to know the signs and symptoms of hypoglycemia. You have to know them. So, I want you to think about a patient. You go into their room and you see them, they're diaphoretic, they're cool, clammy skin, and they're really hungry, and they're nervous, they got the jitters. This patient might have hypoglycemia, so if it comes up on a nursing school exam or on the NCLEX, you're going to want to check what? Their blood sugar, right? And it's always fun to talk to other nurses or other nursing students about what the lowest blood sugar that they've ever seen was. The lowest I've personally ever seen was a 6. And yes, the patient did survive. So, it's kind of fun to look at those and compare war stories. Don't violate HIPAA though, okay? At any rate, with hypoglycemia, if they do have hypoglycemia, you want to provide 6 to 10 pieces of hard candy or a glass of orange juice or cola, or oral glucose, the oral glucose gel. For severe cases, you actually might give glucagon or IVD-50, and I've given that lots of times to patients. That'll really be good for you if the patient isn't able to tolerate anything by mouth or if they're unconscious. So very good thing to have, and it's amazing how patients perk up very quickly most of the time after getting that glucagon or D50. For hyperglycemia, insulin may be given AC or HS according to MD order or sliding scale. Make sure that you as a nursing student understand what a sliding scale is and how to calculate it based on what the physician's order is. Make sure that you anticipate hyperglycemic or hypoglycemic reactions with the particular type of insulin. And what I'm getting at with that is, I've seen questions that I've utilized on nursing school exams that state something to the effect of, your patient is given NPH insulin at 9 a.m. on Saturday morning. At what point on Saturday would you expect them to have a hypoglycemic reaction? Well, you would expect them to have that during the peak of the insulin. And that's why I said earlier that it's really important to understand the peak, the onset, and the duration of all of the different types of insulin that are in your textbook and that were described by your nursing school instructors. So make sure that you know them. We also want to teach the patient how to self-administer insulin injections as ordered, and also know and understand how to eat meals. Follow the provider and dietitian's particular guidelines with reference to meals. They need to know about the glycemic index and things like that. So make sure that you do good, adequate patient teaching. Again, my name's Nick the Nurse. I want to thank you for watching my video today. If you'd like to check out any of my other free videos, they're all at www.nickthenurse.com. Thanks, and we'll see you next time.